What if I told you that the habit you think is keeping you healthy might actually be silently destroying your heart right now? My name is Dr. Vasconcelos, and in my 25 years as a heart surgeon, I've seen this deadly pattern destroy thousands of lives. Before we dive deep into this life-saving information, I want you to do something for me. Leave a comment below telling me which city you're watching from. I read every single comment, and it helps me understand where my message is, reaching people who need to hear this most. Now, what I'm about to share with you today isn't just another medical lecture. It's an urgent warning that could literally save your life or the life of someone you love. The habit I'm talking about affects over 70% of seniors, and doctors rarely warn you about its devastating effects on your cardiovascular system. Most people think they're doing something good for their health, but in reality, they're creating the perfect storm for heart attacks, strokes, and sudden cardiac death. I've performed emergency surgeries on patients who were shocked to discover that their healthy routine was actually the reason they ended up on my operating table. The medical evidence is overwhelming, yet this information is buried in research papers that most people never see. What makes this even more tragic is that this habit creates a false sense of security. People think they're protecting themselves while unknowingly accelerating their journey toward cardiac disaster. The pharmaceutical industry doesn't want you to know this because it would drastically reduce their profits from heart medications. Insurance companies stay quiet because treating the consequences is more profitable than preventing them. But as a surgeon who has held failing hearts in my hands, I have a moral obligation to warn you. This isn't about selling you supplements or expensive treatments. This is about saving lives through knowledge that's been deliberately kept from you. The habit we're discussing today triggers a cascade of physiological changes that most doctors don't fully understand, which is why they miss the connection between this seemingly innocent behavior and the explosion of heart disease in seniors. By the end of this video, you'll understand exactly why this habit is so dangerous, how it's probably affecting your body right now, and most importantly, what you can do to reverse the damage before it's too late. But I need you to stay with me until the very end, because what I reveal in the final minutes could be the difference between living a long, healthy life and becoming another tragic statistic. The habit that's silently killing seniors across America is something so common, so accepted, that questioning it almost seems ridiculous. But here's what most people don't know. This habit creates a metabolic chaos inside your body that directly attacks your cardiovascular system in ways that are both immediate and cumulative. When you engage in this behavior, your body releases stress hormones that cause your blood vessels to constrict, your blood pressure to spike, and your heart to work overtime just to maintain basic circulation. The scary part is that these changes happen within minutes, but the damage accumulates over months and years until your cardiovascular system reaches a breaking point. If you're enjoying this information and finding it valuable, please hit that like button. It helps more people discover this life-saving content. Now let me explain the science behind what's happening in your body. Every time you participate in this habit, your sympathetic nervous system activates, flooding your bloodstream with adrenaline and cortisol. These stress hormones cause your heart rate to increase dramatically, sometimes by 30 to 50 beats per minute above normal. Your blood vessels, particularly the smaller arteries and capillaries, begin to constrict, forcing your heart to pump harder to maintain adequate blood flow to your organs. This increased workload doesn't just stress your heart muscle, it damages the delicate inner lining of your arteries, called the endothelium. This damage creates rough patches where cholesterol and other substances can stick, forming the plaques that eventually cause heart attacks and strokes. But here's what makes this habit particularly insidious. It also affects your body's ability to regulate blood sugar and inflammation. The stress response triggered by this behavior causes your liver to release stored glucose into your bloodstream, even when you don't need it. This creates a state of chronic mild diabetes that further damages your blood vessels and accelerates the atherosclerosis process. The inflammation markers in your blood skyrocket, turning your entire cardiovascular system into a war zone where your own immune system begins attacking healthy tissue. Most seniors have no idea this is happening because the symptoms develop gradually and are often mistaken for normal aging. But here's the truth. What you think is normal aging is actually your body's response to decades of this harmful habit. The medical research is crystal clear about these connections, but most doctors don't have time to explain the complex biochemical pathways involved. That's why I'm taking the time to break this down for you in simple terms that anyone can understand. What I'm about to reveal next about how this habit affects your brain and memory will shock you. What almost nobody talks about is how this habit doesn't just affect your heart. It creates a domino effect that destroys your entire circulatory system from the inside out. The cardiovascular damage begins at the cellular level, where the repeated stress response causes your blood vessels to lose their elasticity and become rigid. This condition, called arterial stiffening, forces your heart to work exponentially harder to pump blood through increasingly inflexible pipes. Imagine trying to push water through a garden hose that's been left in the freezing cold. That's essentially what happens to your arteries when you engage in this destructive habit repeatedly. The medical term for this is endothelial dysfunction, and it's the first step toward every major cardiovascular disease. Your endothelium is supposed to be smooth and flexible, producing nitric oxide that keeps your blood vessels relaxed and your blood flowing freely. But this habit causes the endothelial cells to become inflamed and damaged, reducing nitric oxide production by up to 60%. Without adequate nitric oxide, your blood vessels can't dilate properly, your blood pressure rises, and your risk of blood clots increases dramatically. Here's something that will terrify you. This process is happening right now in your body if you've been engaging in this habit, and you probably have no idea because there are no obvious symptoms until the damage is severe. The inflammation caused by this habit also activates your body's clotting system, making your blood stickier and more likely to form the clots that cause heart attacks and strokes. Your platelets become hyperactive, clustering together at the slightest provocation. Your fibrinogen levels rise, creating a protein mesh that makes clots stronger and harder to dissolve. Even your red blood cells change shape, becoming less flexible and more likely to get stuck in small blood vessels. This creates a perfect storm for what doctors call thrombotic events, the medical term for blood clots that can kill you instantly. But the damage doesn't stop there. This habit also triggers the release of inflammatory cytokines, proteins that signal your immune system to attack your own cardiovascular tissue. These cytokines cause the smooth muscle cells in your artery walls to multiply and grow, creating bulges and weak spots that can rupture without warning. When an arterial plaque ruptures, it can completely block blood flow to your heart or brain in seconds. Most people who die from sudden cardiac death never saw it coming because they didn't understand how their daily habits were setting them up for disaster. The research shows that people who engage in this habit have inflammation markers that are 3 to 5 times higher than normal, putting them in the same risk category as people with active infections or autoimmune diseases. If you know someone who needs to hear this information, please share this video with them. It could literally save their life. But here's where this gets even more frightening. This habit doesn't just damage your heart and blood vessels, it completely disrupts your body's metabolic processes in ways that accelerate aging and increase your risk of virtually every chronic disease. When you engage in this behavior, your body's stress response system goes into overdrive, releasing cortisol levels that rival those seen in people with severe chronic illnesses. This sustained cortisol elevation wreaks havoc on your metabolism, causing your body to break down muscle tissue and store fat in all the wrong places, particularly around your organs. This visceral fat isn't just cosmetic, it's metabolically active tissue that produces inflammatory compounds that directly attack your cardiovascular system. The fat cells around your heart and liver become factories for producing cytokines and other inflammatory molecules that keep your body in a constant state of low-grade inflammation. This inflammation interferes with your body's ability to process insulin properly, leading to insulin resistance and eventually type 2 diabetes. Here's what most doctors won't tell you. Diabetes isn't just about blood sugar. It's actually a cardiovascular disease that doubles your risk of heart attack and triples your risk of stroke. The high glucose levels in your bloodstream act like tiny pieces of glass, scraping and damaging the inner walls of your blood vessels every time your heart beats. This damage creates more sites for atherosclerotic plaques to form, accelerating the narrowing of your arteries. But the metabolic damage goes even deeper. This habit interferes with your body's ability to produce and utilize key nutrients that are essential for cardiovascular health. Your magnesium levels drop, affecting your heart's electrical system and increasing your risk of dangerous arrhythmias. Your vitamin D absorption decreases, weakening your immune system and increasing inflammation throughout your body. Your omega-3 fatty acid levels plummet, reducing your body's ability to fight inflammation and maintain healthy cell membranes. Most critically, this habit severely impacts your body's production of glutathione, your master antioxidant that protects your cells from oxidative damage. Without adequate glutathione, your cardiovascular system becomes vulnerable to free radical damage that accelerates aging and increases your risk of heart disease, cancer, and neurodegenerative diseases. The research shows that people who engage in this habit have glutathione levels that are 40 to 60% lower than healthy individuals. This creates a state of chronic oxidative stress that literally rusts your body from the inside out. Your DNA becomes damaged, your cellular repair mechanisms become overwhelmed, and your organs begin to age at an accelerated rate. What I'm about to reveal next about how this affects your brain and cognitive function will make you want to quit this habit immediately. The devastating effects of this habit extend far beyond your heart and into your brain, creating a cascade of neurological damage that most people never connect to their cardiovascular health. Your brain consumes 20% of your body's total oxygen supply, making it extremely vulnerable to the circulation problems caused by this habit. When your blood vessels become damaged and constricted, your brain doesn't get the oxygen and nutrients it needs to function properly. This chronic state of mild hypoxia, reduced oxygen levels, causes your brain cells to become stressed and begin dying at an accelerated rate. The area of your brain most affected is the hippocampus, which is responsible for forming new memories and learning. This is why people who engage in this habit often experience what they dismiss as senior moments. But these aren't normal aging processes. They're signs of brain damage caused by reduced blood flow. Before I continue, if you're finding this information helpful, please consider subscribing to my channel and hitting the notification bell. I regularly share life-saving medical information that could protect you and your loved ones. The neurological damage caused by this habit follows a predictable pattern. First, you'll notice subtle changes in your ability to concentrate and focus. Tasks that used to be easy become more difficult, and you find yourself getting distracted more easily. This happens because the prefrontal cortex, the part of your brain responsible for executive function, is highly sensitive to reduced blood flow. As the damage progresses, you'll start experiencing more frequent memory lapses, difficulty finding words, and problems with spatial orientation. These symptoms are often dismissed as normal aging, but they're actually early signs of vascular dementia, a condition that's directly caused by poor cardiovascular health. The inflammation caused by this habit also triggers the activation of your brain's immune cells called microglia. When microglia become overactive, they begin attacking healthy brain tissue, causing the kind of damage we see in Alzheimer's disease. This is why cardiovascular disease and dementia so often occur together. They're both caused by the same underlying inflammatory processes. The stress hormones released by this habit also interfere with your brain's ability to produce new neurons, a process called neurogenesis. Your brain is supposed to generate new brain cells throughout your entire life, but chronic stress shuts down this process, leaving you with a shrinking brain that can't adapt to new challenges or recover from damage. The research shows that people who engage in this habit have brain volumes that are 5 to 10% smaller than healthy individuals, with the most significant shrinkage occurring in areas responsible for memory and emotional regulation. This explains why this habit is also strongly linked to depression and anxiety disorders. Your brain literally can't produce the neurotransmitters needed for emotional stability when it's under constant stress. The blood-brain barrier, which normally protects your brain from toxins and inflammatory compounds, becomes leaky when exposed to chronic stress, allowing harmful substances to enter your brain tissue and cause further damage. What's truly terrifying is that this neurological damage is often irreversible, which is why it's so critical to stop this habit before it's too late. What will shock you even more is how this habit systematically destroys your immune system, leaving you vulnerable to infections, cancer, and autoimmune diseases, while simultaneously accelerating every aspect of the aging process. Your immune system is intimately connected to your cardiovascular system, and when one fails, the other quickly follows. The chronic stress response triggered by this habit causes your body to produce excessive amounts of cortisol, which is nature's most powerful immunosuppressant. This isn't just temporary suppression. We're talking about a complete restructuring of your immune system that leaves you defenseless against threats that a healthy person would easily fight off. The stress hormones released by this habit cause your thymus gland, which produces T cells that fight infections and cancer, to shrink dramatically. By age 60, most people's thymus glands have already shrunk significantly, but this habit accelerates the process by decades. Your white blood cell count drops, your natural killer cells become less effective, and your body's ability to recognize and destroy abnormal cells becomes severely compromised. This is why people who engage in this habit have significantly higher rates of cancer, particularly lung cancer, even among those who have never smoked. The inflammation caused by this habit also triggers autoimmune responses, where your immune system begins attacking your own healthy tissues. Your body becomes unable to distinguish between foreign invaders and your own cells, leading to conditions like rheumatoid arthritis, inflammatory bowel disease, and autoimmune thyroid disorders. The chronic inflammation also disrupts your body's ability to repair damaged DNA, allowing genetic mutations to accumulate that can lead to cancer. Your antioxidant systems become overwhelmed, creating a state of oxidative stress that damages every cell in your body. The mitochondria in your cells, which produce energy, become dysfunctional and begin producing more harmful free radicals than useful energy. This cellular energy crisis affects every organ system, but it's particularly devastating to your heart, which requires enormous amounts of energy to function properly. Your heart muscle cells begin to die, your electrical conduction system becomes unstable, and your risk of sudden cardiac death increases exponentially. The immune system damage also affects your body's ability to heal from injuries and fight off infections. Small cuts take longer to heal, you get sick more frequently, and when you do get sick, it takes much longer to recover. Your vaccine responses become weaker, leaving you vulnerable to diseases that vaccines are supposed to prevent. Most frighteningly, this habit accelerates cellular aging by damaging your telomeres, the protective caps on your chromosomes that determine how long your cells can survive. Every time your cells divide, your telomeres get shorter, and when they become too short, the cell dies. This habit causes your telomeres to shorten at twice the normal rate, essentially aging your body 2 years for every year you engage in this behavior. Have you noticed any of these immune system changes in yourself or someone you know? Leave a comment below. I'm curious to hear about your experiences. The destruction caused by this habit creates a domino effect that devastates every major organ system in your body, creating a cascade of health problems that most people never realize are connected. Your kidneys, which filter your blood and regulate your blood pressure, become severely damaged by the chronic inflammation and elevated stress hormones. The small blood vessels in your kidneys, called glomeruli, become scarred and unable to filter waste products effectively. This leads to a buildup of toxins in your bloodstream that further damage your cardiovascular system and accelerate kidney failure. The high blood pressure caused by this habit forces your kidneys to work harder, creating a vicious cycle where kidney damage leads to higher blood pressure, which causes more kidney damage. Your liver, which processes toxins and produces essential proteins for blood clotting and immune function, becomes overwhelmed by the constant stream of stress hormones and inflammatory compounds. The liver cells become fatty and inflamed, a condition called hepatic steatosis, which interferes with the liver's ability to produce albumin, the protein that keeps fluid in your blood vessels. Without adequate albumin, fluid leaks into your tissues, causing swelling and putting additional strain on your already compromised cardiovascular system. Your digestive system suffers tremendously because the stress response diverts blood flow away from your stomach and intestines. This leads to chronic digestive problems, nutrient malabsorption, and an imbalance in your gut microbiome that affects your entire immune system. The healthy bacteria in your gut, which produce vitamins and help regulate inflammation, die off and are replaced by harmful bacteria that produce toxins. These toxins enter your bloodstream through your now leaky gut lining and travel directly to your heart and brain, causing additional inflammation and damage. Your endocrine system, which regulates hormones throughout your body, becomes completely disrupted. Your thyroid function decreases, slowing your metabolism and making it harder to maintain a healthy weight. Your sex hormone production drops dramatically, affecting not just your libido but also your bone density, muscle mass, and cardiovascular health. Your growth hormone production, which is essential for cellular repair and regeneration, becomes virtually non-existent, accelerating the aging process throughout your body. Your bones become weak and brittle because the chronic inflammation interferes with your body's ability to absorb calcium and other minerals. Your muscles begin to waste away, a condition called sarcopenia, which not only affects your strength and mobility, but also reduces your metabolic rate and increases your risk of falls and fractures. Your skin ages rapidly, becoming thin and fragile, which might seem cosmetic but actually reflects the same vascular damage that's occurring in your heart and brain. What's most tragic is that all of these changes are happening simultaneously, creating a perfect storm of health problems that overwhelm your body's ability to heal and recover. The medical system treats each of these problems separately, never addressing the root cause that's driving all of them. Right now, as you're watching this video, this habit might already be causing dangerous changes in your body that require immediate attention. The warning signs are subtle at first, but they're your body's desperate attempt to tell you that your cardiovascular system is in crisis. If you've been experiencing unexplained fatigue, especially the kind where you feel tired even after a full night's sleep, this could be a sign that your heart is struggling to pump efficiently due to the damage caused by this habit. Your heart muscle becomes weakened and can't generate the force needed to circulate blood effectively throughout your body. This forces your heart to beat faster, just to maintain adequate circulation, which is why you might notice your resting heart rate has increased over the past few months or years. Many people dismiss this as getting older, but a healthy heart should maintain a steady, efficient rhythm regardless of age. Another critical warning sign is shortness of breath during activities that used to be easy. If you find yourself breathing hard after climbing a flight of stairs or walking a short distance, this indicates that your heart and blood vessels can't deliver enough oxygen to your muscles. This isn't normal aging, it's cardiovascular disease in action. Your blood vessels have become so damaged and constricted that they can't dilate properly to meet your body's increased oxygen demands during physical activity. Chest discomfort, even if it's mild and intermittent, should never be ignored. This habit causes inflammation in the coronary arteries that supply blood to your heart muscle. When these arteries become narrowed by atherosclerotic plaques, you might experience chest tightness, pressure, or a burning sensation, especially during physical or emotional stress. Many people, particularly women, experience what's called silent ischemia, heart muscle damage that occurs without obvious chest pain. Instead, you might feel nauseous, lightheaded, or experience pain in your jaw, neck, or arms. If you've been having trouble concentrating or remembering things, this could be a sign that your brain isn't getting adequate blood flow due to the vascular damage caused by this habit. Many people notice that their thinking becomes foggy or that they have difficulty finding words, especially when they're stressed or tired. Your sleep quality might also be deteriorating because your cardiovascular system can't effectively deliver oxygen to your brain during sleep. You might find yourself waking up frequently during the night or feeling unrefreshed in the morning, even after 8 hours in bed. Changes in your vision, such as seeing floaters or experiencing episodes of blurred vision, can indicate that the small blood vessels in your eyes are being damaged by the same inflammatory processes affecting your heart and brain. Your kidneys might be showing signs of damage through changes in your urine output or color, swelling in your legs and ankles, or unexplained weight gain from fluid retention. If you've noticed any of these warning signs, please don't wait. See a healthcare provider immediately. But more importantly, you need to understand exactly what this deadly habit is and how to stop it before it's too late. The habit that's been silently destroying your cardiovascular system is chronic sleep deprivation, getting less than 7 hours of quality sleep per night. This might seem impossible to believe, but the scientific evidence is overwhelming and undeniable. When you consistently get insufficient sleep, Your body remains in a constant state of stress that triggers every single destructive process I've described in this video. Your sympathetic nervous system stays activated, your cortisol levels remain elevated, your inflammation markers skyrocket, and your cardiovascular system never gets the chance to rest and repair itself. During deep sleep, your body is supposed to enter a restorative state where your blood pressure drops, your heart rate slows, and your blood vessels relax. This is when your endothelial cells repair themselves, your immune system resets, and your brain clears away the toxic proteins that cause dementia. But when you don't get enough sleep, none of these critical repair processes can occur. Instead, your body remains in a state of chronic emergency, constantly releasing stress hormones that damage your cardiovascular system. The research shows that people who get less than 6 hours of sleep per night have a 48% higher risk of heart disease and a 15% higher risk of stroke. Even getting just 1 hour less sleep than you need increases your risk of coronary artery calcification by 33%. What makes this particularly tragic is that many seniors unknowingly sabotage their own sleep through habits they think are healthy. Drinking caffeine late in the day, using electronic devices before bed, eating large meals in the evening, and taking daytime naps all interfere with your ability to get the deep, restorative sleep your cardiovascular system desperately needs. The blue light from screens suppresses melatonin production, making it harder to fall asleep and reducing the quality of your sleep. Caffeine can stay in your system for 8 to 10 hours, so that afternoon cup of coffee could be keeping you awake at night without you realizing it. Even worse, many medications that seniors take for other health conditions can interfere with sleep quality, creating a vicious cycle where poor sleep worsens your health problems, requiring more medications that further disrupt your sleep. The solution isn't complicated, but it requires commitment and consistency. You need to prioritize getting 7 to 9 hours of quality sleep every single night. This means creating a sleep schedule and sticking to it even on weekends. Your bedroom should be completely dark, cool, and quiet. You should stop using electronic devices at least 2 hours before bedtime and avoid caffeine after 2 p.m. If you're taking medications that might be affecting your sleep, talk to your doctor about alternatives or timing adjustments. Most importantly, you need to understand that sleep isn't a luxury. It's a biological necessity that's as important as food and water for your survival. Every hour of sleep you lose is an hour of cardiovascular repair that doesn't happen, and the damage accumulates over time until your system fails. But here's what might surprise you. There's another habit that's even more dangerous than sleep deprivation, and it's something that 90% of seniors do every single day without realizing the deadly consequences.